This medical case was published in the International Journal of Infectious Diseases in September of 2018. A 69-year-old woman from Seattle first came to doctors for a sinus infection that wouldn't go away no matter what she did. She was prescribed a neti pot to rinse out her sinuses and hopefully bring her some relief. Soon after this, however, the woman developed a quarter-sized rash on the right side of her nose. In addition, she had some raw red skin on the inside of her nasal passages. Despite visiting the dermatologist multiple times, the rash persisted. Then, after around 12 months after she first noticed the rash, the woman had a seizure. After a CT scan, doctors found a 1.5 centimeter large ulcer in her brain. Her neurosurgeon initially thought that it was a tumor. This wasn't unlikely as the woman had a history with breast cancer. However, when removing the mass, the neurosurgeon found just dead tissue. Upon sending it to pathology, the mass was reported to look amoebic. The Centers for Disease Control and Prevention sent the hospital a new drug to test out, but the infection was already too severe. The brain infection turned out to be a type of brain-eating amoeba called B. mandrillaris. This amoeba was found in tissue samples both from her brain mass and from inside of her nose. These infections are reported to be extremely unusual and almost always fatal. Doctors suspect that the woman contracted this amoeba by using unsterile water for a neti pot, although little is known about this infection. The amoeba resembles immune cells under the microscope and looks similar to tumors or bacterial infections on CT scans. In addition, B. mandrillaris only grows on mammalian tissues, not on agar plates, which are commonly used to culture cells in labs. Although difficult to diagnose or cure, a B. mandrillaris infection is extremely rare, so people shouldn't panic about this. However, doctors stress that people should use a sterile water for a neti pot.